Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Cost-effective, non-invasive, and drug-free are a few perks of chiropractic care. And this hour on Healthy Living, we are talking about the relationship between the body's alignment and your overall health. And joining us today is Dr. Tovar, a chiropractor at the Dynamic Chiropractic Center, and she is also a life coach and a public speaker. Welcome to the show, Dr. Tovar.
Thank you, Kathy, for having me.
You're
it's
a triple
pleasure.
whammy. I love this. A chiropractor, public speaker, life coach. So I know you're going to bring a lot of valuable information to the show today.
Yes, well, I look forward to sharing my passion with the people so they can live better lives.
Okay, so your mission is to help the community live healthier and fuller lives, which we all love. So tell us about how you do this as a chiropractor.
Well, I think we all chiropractors, we have this blessing of using our art to help bodies function better. So people can get in touch with the inner doctor inside. So as chiropractors, our mission is to educate as many people as we can into the inner healing power of the body, and through gentle adjustments, regain that power back so the power can start working and people can start healing of all these things that they suffer, that they shouldn't be suffering from. So it is a blessing for me as a chiropractor to give that mission to the world, to be able to put my little grain of salt and help them live better lives.
And I think it's so interesting as well that when we talk about alignment, it's not just a physical alignment. You're talking about alignment of the whole body.
Yes. The body is not parts. We tend to look at it as parts, but the body is a whole. And when you affect one area, it's going to affect the other. So that's why we see the body as a whole, just like health is a whole. It's a component of different aspects, but it works as a whole. So yes, when you affect the spine, you're affecting every single organ, tissue, and cell, and you're helping the body function at its best 100%.
So what got you, I love asking this question, what got you to be or want to be a chiropractor?
Well, actually, I think my story is very unusual. And it's not the typical chiropractic story, but I love sharing it because obviously it is what got me into this beautiful profession for the last 20 years.
Wow.
So I just imagine me, immigrant from Venezuela. I got to this country when I was 14 years old. I didn't know a word of English. And I had already been suffering of migraines since I was 10 years old. Constipation, I would go to the bathroom once a week.
Oh my goodness.
It was pretty horrible. And I just remember my high school years as a blur because I was constantly with migraines 3 days out of every week. And I would get pains and then have to go to the bathroom only once a week. So I started taking bare aspirin. That was like my go-to thing because back then, that's the only thing that existed for headaches. And little did I know, it just started damaging my body without me knowing it.
Right.
When I was 18 years old, I got a part-time at a chiropractor's office. I still had all these migraines and all this symptomatology, but I didn't know any better. So I started working there, and within a month they taught me that it wasn't normal for me to live this way, and it wasn't normal to be having to take medications for my headaches to go away. So they started adjusting me and they started teaching me how the power of the body can heal the body. I found this super interesting. But in that process, I ended up getting really sick and I ended up in the hospital with a liver condition.
From
all the aspirin had destroyed my liver. I ended up seeing 3 different internists that told me I had to take medications for the rest of my life.
Oh my God, horrible to hear when you're 18 years old.
Medications for my stomach, medications for my liver, medications to go to the bathroom, medications for my headaches. So by that time, I'd been working with a chiropractor for a month and a half. So I said, you know what? I'm going to believe what the chiropractor says.
Right.
I'm not going to take any medications.
What do you have to lose at that point?
So I remember my mom crying. She's like, oh my gosh, she's going to die. And I just walked out of the doctor and I said, I will never take any of this because my body's going to heal. It was a long journey, but within a year, I was in chiropractic school. And it took almost a year for my symptoms to subside because it was a lot of cleansing since I was a little girl.
So at that point, when you started getting involved in chiropractic
care, I found, actually, I lost that job at a chiropractor because I missed a week of school for being in the hospital. And I ended up working for another chiropractor, and that took like 6-8 months before I decided I'm going to be a chiropractor. I saw so many lives being changed in their offices, and I saw my life, even though I still have symptomatology, starting to change and starting to heal from within without the need of the bare aspirin or the different things I was taking to go to the bathroom. So yeah, it changed my life, and I just thought it was the coolest thing I could do for others.
Well, it's not unusual. It's a very motivating story.
Yes.
I would change that adjective.
Yes.
Now, we have a list of some patients who can benefit from seeing a chiropractor, and I want to go over those with you, Dr. Tovar. So let's look at this to get a sense of the range of patients that you see daily.
Yes, obviously those symptoms are on the screen are very similar. The symptoms are common for us to see in our offices daily. Yes, back and neck pain, headaches, as I mentioned. I'm very passionate with people that suffer of migraines because I suffer with them for so long, and I know how debilitating.
And you can relate to the patient.
I can totally relate when somebody says, oh, I go to sleep, I wake up with the same headache, I feel nauseous. I totally relate, and it's not fair. It's not the way to live. I never had a migraine ever since. Only when I was pregnant, I had a couple because of the hormones, but not again. So yes, you could live without headaches. And people with problems, digestive, allergies, asthma, injuries, definitely back problems. I see from the range from babies since they're born. We check them because the trauma of being born can be affective to the baby, and they start having colics or not latching correctly, or so many other torticollis because of being pulled, right? So I see a big range, and it goes from people, from athletes that want to do better, to women that want to get pregnant, women that are pregnant, people that are dealing with arthritis, people that are dealing with debilitating conditions, to help them live better.
I mean, when I was pregnant, I actually did see a chiropractor about once a week to get my back aligned.
Yes.
And it was because I had the sciatic
it removes
pain.
the pressure, because those ligaments tend to move, and then it puts pressure on the sciatic nerve, and it's not okay.
I looked forward to that chiropractic appointment every single week, 30 minutes. I knew I was going to be in there with a doctor, and it was life-changing.
Yes. So many people, and it's so safe. We have the tables for it. We have studied hard for the techniques to use for pregnant women. So safe and so effective.
Yes.
That it is the best choice you got, because what are you going to do? Take medications?
You can't.
You're pregnant.
Right.
So yes, I highly recommend it. And yes, it's a big scope of patients that we see with different ailments, because people might come in because of a low back pain, and they never told me they had stomach issues.
Right.
And when we do the revaluation, they tell me, oh, my stomach issues are gone.
Interesting.
And
with that connection.
Because it is the connection. I don't get to decide what goes first. The body has its own priority list, and it will decide what is best for it.
Now, we are going to talk more about this, but I do want to take a moment to let our viewers know at home, you can call in if you have a question for Dr. Tovar. Maybe you're experiencing some of these problems we're just talking about, so why not call? That number is 855-796-4475. The doctor's standing by, and we'd love to hear from you. Now, let's go ahead and cover some basics about chiropractic care, and by going over some anatomy. And I love that you brought the spine in the back here. So let's talk about this. And what is it that we're looking at here? What's important to note?
Okay. I'm not going to bombard you with too many anatomical, but what we want to know, and what's most important, and the reason I actually have a job, is what goes inside the spine. Okay. Yes, we see the bones, but what's most important is the first organ that forms in your body is your nervous system.
Right.
Which the first part is right up there, which is your brain. The brain then lands in the first two vertebrae of your spine, and then goes the spinal cord that goes inside all these bones. It's like this power that made this body so smart that it covers the most important organ fully with bones.
Right.
So all these bones that are movable, right? We have 24 movable bones. We have 7 in your cervical spine, which is your neck. Then we have 12 in your thoracic and 5 in your lumbar.
And these bones are held together by discs.
They have discs in the middle, which are gelatinous substances, and they help the mobility and the flexibility. And then each nerves come out of each side of the vertebra, okay, to every organ, tissue, and cell. So the messages need to go from the brain to the body through this system that runs inside the spine, and so on the way back. So if you touch your leg and you feel that, right, it's because a message is going back through your spine, up the brain, to send through another channel. So
the control center is right here.
Center. So it's just like if you have like 100% battery on your cell phone, and everybody likes that nowadays, right? But your connection to Wi-Fi is really bad.
Right.
So you won't be able to send the message or the email or
That's
the picture.
Such a great analogy. Yes.
Well, it is an analogy that most of my teenagers can relate to. They don't understand anatomy, but they understand
having battery on their phone.
You want 100% battery in your phone? Well, this is it. We all have this 100% battery, and our job is to keep it running as free of interference as possible, because that's how the messages are getting through, and there's no frustration and no stress attached to not being able to send a message.
Okay, Dr. Tovar, so then when I'm looking at a healthy alignment, this is what a healthy alignment looks like.
Actually, my spine has been, this is the spine that I brought from my office, and I have used it so much for classes that it's kind of crooked.
So let's make it healthy.
But I'm going to make it as healthy as I can. So when we have a healthy spine, we have 3 curves. Can I pull it out? Yes. Okay, let's do this. All right. So we have 3 nice curves. We have a curve in your neck that is supposed to be more like a banana curve, so we are going to make it exaggerated. And this is going to help the brain send the messages through this first area of your spine. So important to keep that nice curvature.
Right.
Because we're sitting all the time or we're looking down, we have too many straight necks. And those straight necks are pulling on the cord and damaging part of your nervous system. So this curve right up here, super important.
Okay.
Then we have another curve in our thoracic, okay, which is a kyphosis. We call this lordosis, and we call the one in your lumbar lordosis.
Lordosis.
And this is a kyphosis.
Kyphosis.
Yes. And again, I don't want to bombard you, but these curves make your body 16 times stronger and 16 times less of chances of getting sick. So it's important to keep these curves. Yes, this is what we look, and it's important to keep the nerves are going on each side of the vertebra without pressure from the bones.
Right.
And that's what we do in chiropractic. We find that pressure. If there is a bone out of place putting pressure on the nerve, that's called a subluxation. And what we do is we find it, we analyze it, and we correct it to help that body heal and to restore the flow from the brain into the body through that nerve.
And we're gonna go more into details when we come back. So we're gonna get into how doctors check for the alignment and the nervous system when we come back. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
A smile. It can show how we feel. It can change the course of our lives. But what would life be like if you weren't able to smile? It doesn't have to be this way. Since 1999, Smile Train has been helping children experience the simple joy of a smile. To learn more, call or go online now.
If you're like me, when you have the flu, you don't want to go anywhere. And when your kid has it too, life is just awful.
And why should you go anywhere when you'll probably feel better just staying in bed anyway?
That's why Baptist Health's Care on Demand is so crucial. Care right from your bed.
How are you feeling today?
Yeah, we've been sick for a couple days now. I can even get my prescriptions ordered through my care provider after my visit. Hey, hon, could you pick that up at the pharmacy on your way home?
And it's care right away, not hours of driving in the car and then sitting in a waiting room.
Because when I have the flu, there's only one thing I feel like doing.
This is my kind of happy hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride.
My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
I may look like all the other dogs, but I was born for a purpose. To one day be your companion, your eyes to see the world. I'll be your courage, your friend. With me, you'll find new freedom and hope for a better future. A dog I'm not. I'm a Southeastern guide dog.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Aura Tovar, a chiropractor at the Dynamic Chiropractic Center, and she's also a life coach and a public speaker. If you have a question, give us a call. The toll-free number is 855-796-4475. Dr. Tovar, I want to talk about how the different areas of the spine actually affect different areas in our body and how that connection that we were talking about. So if we can talk a little bit about that.
Yes, for sure. On every area, a lot of people think, okay, if I have pain here, this is the area where you'll be talking. But sometimes we have what we call referral pain. So you can have pain that is coming from your mid-back and is actually in your cervical where the misalignment is at. Also, every area of your body is connected to different organs and tissues. A lot of people are like, well, I have allergies, or I have glands problems, or I have dizziness, or headaches, or I have ear problems. Why are you touching here? Because it's all connected. It has to go through your spine before it goes to those organs, tissues, and cells. A lot of people have stomach problems, just like I did when I was young. And yes, it's in my thoracic spine. That's the connection to the nervous system. The same with your reproductive organs. Why are you contacting my hips and my lower lumbar? Because those are the areas that are going to send the messages to those. So yeah, people with pain in the feet, pain in the legs, with bad circulation, is everything. People are like, but my pain is right down there. Why are you touching me right up here? Right. Because it's all connected, and it has to go through the source before it gets to that area. And there's connectors that go specifically to each part of the body.
Let's talk about the big questions that I'm sure many patients have, which is, what caused my disalignment? So what are the different ways that you can disalign the spine?
Oh, I think this is a very, very, very good question, because a lot of people do ask it. And I go back to, okay, we live in a stressful world, and we all have physical stress, right? And some examples of physical stress can start in the moment the baby is born. That could be a trauma, right? And then the baby starts walking and he falls how many times? Thank God he never gives up, right? You have kids and grandkids that never gave up, and that's why they're walking now. So you fall, and then you start with the backpacks, and then you get into accidents and falls. All that is physical stress. Our posture on a daily basis, our constant sitting disease, our constant looking down at our cell phones, that is physical stress. Then we go to chemical stress, right? We all exposed to chemicals in our cleaning products, the things we consume when we don't do all organic and we don't watch what we're eating, the chemicals that we consume in the form of pharmaceuticals, all that is chemical stress. And if we do alcohol and abuse other drugs, same thing. Mental stress. Hey, who doesn't have mental stress, right? Just driving in Miami. Right. Or just opening your cell phone in the morning and looking at the news and bombarded. We are more emotionally stressed now than ever before because we have too many
so
inputs
much coming our way.
From every angle. So all those stresses start just building up in your spine, and you need to have some way to let it out and some way to align it so it doesn't form a misalignment like we call the subluxation. Right. So that's why it's so important. If you're going to use your spine, you need to maintain it just like you would your teeth, just like you would your nails or your hair or the car you expect to drive all the way over here, right? A lot of people tell me, until when do I have to go to a chiropractor? I said, I don't know. It's just like until when you have to put gas in your car until you want to drive it. It's just very simple. It's a choice. If
it's
you don't,
the same way that you take care of the rest of parts of your body, the spine.
With the difference is that without teeth, we can buy a new set.
Right.
But your nervous system doesn't have an extra. There's no such a thing as a, as a transplant of a spine. It hasn't been invented yet. So we have to take care of this spine because through it runs the organ that controls every other organ, system, and cells.
Absolutely, it's so important. Now, you brought some examples of how your patients benefit from chiropractic visits, and I want to talk about these. I mean, first and foremost, you're removing pain, and that's a beautiful thing.
Mm-hmm. It's not okay to live with pain, and people have been taught that it is okay, and it is not. It's not normal for you to wake up tired and to be in pain all throughout your day and to not be able to enjoy your kids and your grandkids and the quality of life you deserve. So yes, pain is usually the last thing to show up and the first thing to go away. So yes, pain, it is diminished. Your quality of life does improve because when you have better energy, you feel better. You then are able to move better, to love yourself a little bit more, and then be able to smile more at the world, which is what we all want in humanity, right? So yes, definitely more energy, less medications. A lot of my patients get off the pharmaceuticals because they no longer need them.
I feel like this is a chain of events. We start with the removing of the pain, and then it improves your quality of life. You need less medication. You're going to have more energy, and hence leads to a healthy body and mind.
Yes, and which is go to happiness. Remember we said that at the beginning of the show. If we are going to spend this time on earth, might as well have the best quality of life and enjoy ourselves the most we can with what this body can give us, because everybody has a different body and a different expression of their own 100% function. But we can bring out the best that they can with what they have.
Well said.
And that's what we can do.
Now, I want to get into what someone can expect on their first visit at a chiropractor and when someone should consider a chiropractic care. So is there a telltale sign that says, hey, maybe I should go see a doctor?
Well, my opinion, obviously, everybody should get checked. Just like you will get checked, you will get cleanings for your teeth. You need to get checked. If you do have subluxations, it's impeding the way your body functions and heals, which is the actual definition of health. So everybody should get checked because by the time you have symptoms, it's harder. It's harder. Just like by the time you find out you have a disease, it's harder to help it, right? So it's great for prevention because it keeps your immune system working at its best to then avoid disease formation. So I recommend everybody to get their spine checked, at least to see if you have subluxations. If you do, get them adjusted to get to a point where you get to correction, and then you can maintain it. Just like you will maintain a healthy body and keep drinking water and healthy meals,
spine.
You will maintain a healthy spine and then go for your maintenance adjustments because we're still being exposed to the stressors. Unless you move to a mountain and dedicate yourself to meditating 8 hours a day, then probably you won't need to get adjusted anymore. But if you don't, then just maintaining your spine as healthy as possible is going to prevent the disease formation, give you a higher quality of life, and help you be happier while here.
So let's say I'm a patient, I'm walking through the doors of your office. What am I expecting? What's happening?
So you walk in, and hopefully you did the intake forms online. We try to stay green in our office, but yes, we are going to sit down and have a complete history and consultation. We are going to find out where this came from, how long you had it, and we're going to see where your goals are health-wise. Then we're going to do an exam, a complete examination, and that includes 2 nervous system scans because I want to see if there's any nerve pressure.
So scans is separate from x-rays, or?
That is separate from x-rays, yes. At least in my office, I don't have x-rays, so depending how the evaluation and the scans come out, I will refer for x-rays because x-rays is the hard tissue, okay? Scans are the soft tissue. We want to put it together so we can develop the right care plan for that person. So yes, both things are useful tools to see if that person needs care and how much care they need and how it will help them or not.
So let's talk about that care, because there are different types of therapies and adjustments as well.
Yes.
So how do you know what's going to work best, and what kinds of adjustments and therapies are available for a patient?
There are many different chiropractic offices, okay? And I can only obviously speak for mine, even though I know hundreds of chiropractors even in this city. But yes, the most important thing you have to do, whether you use the other therapies, is to get the adjustment if needed, to remove the pressure of your nervous system. Then after your nervous system is clear, then the therapies come handy.
Right.
And they are wonderful, right? You can get massage. In my office, we have massage therapists. Then we also have a traction table. We do some exercises.
And just to clarify, these aren't massages like you go to a spa.
No,
these are
therapeutic
massages that pinpoint specific muscles
that go hand in hand with the adjustment, because it's going to help. There's 7 layers of muscles attached to the spine. So we are going to help those muscles realign themselves with the new way, right? The right way. So we can prevent that from moving out of place. So that's why stretches, exercises, massages, all that help to reinforce the core so you can keep your adjustment and keep your alignment longer. So, but the most important thing in my office is the adjustment. Without the adjustment, all the other therapies are just feel good, and they're just patches. Just like you will patch anything else, it's not going to correct anything.
And Dr. Tovar, I've heard you talk about and bring up children and kids and how sometimes this can even start to get checked when you're very young. You actually do see a lot of children patients.
Yes, I do. I see, I just posted a picture of a baby that brought me a little heart yesterday, and she is 9 months old. And so I check babies since they're born. I check moms when they're pregnant. So we check them throughout their pregnancy, and then they bring their babies. And yes, babies don't need to get adjusted as often. The check is very simple, is very gentle, and if they need an adjustment, they get it, their bodies heal, and then we just check them every 6 months until they start walking, and then it's more often because they start falling and getting bumped.
As expected.
As expected, and that's part of life.
Right.
And just like if you would expect your kid to brush your teeth, this is just, it's a lifestyle that is going to help your body function and heal better, and it's going to help kids to not get sick so often, to not miss school, to not have to be on antibiotics, to not have to have a lesser quality of life. Chiropractic tends to help kids to feel stronger, healthier, to feel even smarter, to the point that they do better in school. They do better in sports.
They want to be good overall.
Same with us, same with everybody, yes.
Now, part of the chiropractic treatments is allowing the body to heal itself. And we'll talk more about this. Plus, we have a few special guests joining us when we come back. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for Dr. Tovar, please call in using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. You can watch a Health Channel live stream or check out videos from previous episodes. We'll be right back.
There's a better way. With Baptist Healthcare on Demand, you can see a Baptist physician from any mobile device or PC anytime from anywhere.
How can I help you today?
Oh, hi. Go to baptisthealth.net/care on demand to enroll for free today.
The purpose of clinical research is to help understand how the human body works and how health and disease come about. So we want to understand what makes good health.
I think women's participation in clinical trials is extremely important because we have an entirely different set of issues, whatever body system you're working with. It's different from a man and from a child, so there are certainly differences there that we need to understand and focus and realize that are specific to women.
Science has shown and taught us that men and women are different in a variety of ways beyond the obvious differences. Our organs are different, our level of our hormones are different, we respond to treatments and medications differently. based on those findings, every single cell in a woman or a man's body is a male or a female cell, and those cells respond differently to different triggers, to different treatments, and to the environment.
Thanks, Coach. Thanks for teaching me about teamwork and leadership.
Thanks for showing me that sports help me stay healthy and do well in school. And thank you for teaching me about concussion.
Letting me know that I should tell you if I think I have a concussion. And how to protect my head and brain. Because one day, I want to be a teacher, an astronaut, scientist, or a coach, just like you. Thank you for protecting my future.
Emily is thinking about taking a dietary supplement. She knows she should try to get her vitamins and minerals from the food she eats, but she doesn't always have the chance to eat right. And with more than 50,000 dietary supplements on the market, like a lot of other people, Emily has questions, like how much vitamin A is good for you and how much is too much. If something's natural, doesn't it mean it's safe? Can folic acid prevent birth defects? Should we be taking calcium and vitamin D supplements? Luckily, there's a place everyone can go for answers. It's the website of the Office of Dietary Supplements. We're part of the National Institutes of Health, and since 1995, we've been conducting, funding, and evaluating research that we use to educate the public, giving Emily plenty of information she can share and discuss with her healthcare providers. We're ODS, for what you need to know about dietary supplements.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with me is Dr. Aura Tovar, a chiropractor at the Dynamic Chiropractic Center. She is also a life coach and public speaker. We also have Christian Diaz Tovar, who is your son and also a patient. So if you have a health question for the doctor, give us a call. The toll-free number is 855-796-4475. Christian, welcome to the show.
Hi, thank you for having me.
Of course, because first let's talk about this, because both your parents are chiropractors,
yes,
correct?
Yes, that's correct.
Okay, so how is that living with two chiropractors at home?
It's pretty cool. Whenever I want, I could just get adjusted and ask them, and I always feel good and healthy all the time, so I like it.
And mom walks around making sure you have good posture, right?
Yes.
Yes, I see that. Okay, so tell me about something. I know that having two parents who are chiropractors, you also want to be a doctor. Is that true?
I feel like it's destiny. Both of my parents are chiropractors, so I just think it fit me.
Mm-hmm. Do you want to be a chiropractor?
I think so. I like the body, and being a doctor, I like that, but I never know.
Okay, so what I wanted to talk to you about, which I find so fascinating, is, like I said, Christian, you are 16, correct?
15.
15 years old. I don't want to age him. I don't want to age your baby. Okay, so and he gets regular adjustments.
Yes.
So tell me why.
Because he lives an active life. He's a soccer player. He's constantly working out. He lives in the world just like I mentioned before. So we are all exposed to the physical stress, chemical stress, mental stress. So I check my kids on a weekly basis. I don't check them because they're hurting or they have pains. I check them because I want to make sure they're clear. Sometimes they don't need an adjustment, but sometimes they do. So we adjust to make sure that they stay well clear, just like you will maintain anything you're using. So yes, they get adjusted. And they ask for it. Can you please check me?
Right.
Just to make sure they're well connected. When they are not feeling good for any reason, I check them more often because it just helps their immune system to fight off whatever they're being exposed to.
Absolutely. Now, Christian, do you remember the first time that you ever got adjusted, or that you maybe asked mom and said, Mom, can we do this, or Dad?
I actually don't, because ever since I was born, I think I've just been getting adjusted, and ever since my earliest memories of being in their office, both of them being chiropractors adjusting me all the time, so I can't remember for the first time.
But do you feel after getting adjusted, do you feel a difference? Do you feel like your performance, whether it's soccer or in school, improve? Can you describe that for us?
Yes, it's a hard feeling to describe because it just makes me feel good and healthy. I wouldn't know how to describe it.
It does, yeah, but you feel more energy. So
yes, do you feel you're more energetic? Do you feel like your mood is different?
Yeah, it makes me happier and more energetic, as in I could strive better.
In your sports? Yeah.
Yes.
Yes, yes.
And Dr. Tovar, at what point, especially when it comes to sports, and I feel as parents, you said sometimes he doesn't even complain about pain, but you want to check. So how important maybe is it for parents to maybe have their children checked, especially if they're playing sports?
Especially, yes. I have a lot of athletes in my office, kids that are into professional sports, even especially the unilateral sports like tennis, golf, bowling. Those are unilateral, so it's putting a lot of stress on the other side of the body. But I have a lot of dancers, gymnasts, soccer players. Why? Because it just helps them do better at their sport. It helps their body stretch further. It helps their body heal from the injuries that they attain during the trainings better. So yes, it is a must. I would consider for every single athlete, just like I think most professional athletes get adjustments. They have their own chiropractor on their team. So yeah, if you want to be the best athlete you can be, getting adjusted and staying well aligned is the way to be.
Okay, I'm going to put Christian on the spot here because you're 15, which means you are at the prime of cell phones and smartphones, and Dr. Tovar, we have to talk about tech snack. And everyone this, are you guilty of that?
At times I do find myself guilty of that, but I always remember posture is key and important, so I always just switch and just go like that.
Look at that, you got mom in your head, don't you? Is that mom telling you like stand up straight, no tech snack?
I always remember, and I also remind everyone, my friends, my family, if I see them slouching, I remind them to stay straight.
Oh, he's destined. He's destined. So you're grooming him well, Dr. Tovar. But yes, can we talk about really quickly about the tech snack, and especially when you see your young patients?
Yes. So in my office, we have a rule that if in my office, at least in my office, you're going to show proper posture. So if you're waiting to be adjusted, or if you're waiting to do your exercises, you see them doing like this. You see them with their phones here, because this is terrible.
Yes.
And we do in our office, we have traction for your cervical spine, in which we re-educate those muscles in order to be able to look up like we're supposed to, because everybody's looking down. I always say to my daughter that concerns that people are looking at her, I'm like, honey, everybody's looking down. They're not looking at you.
Exactly.
They are too concerned with their phones. Nobody's looking at you.
It would be nice if someone looked up from that
phone. So we're missing life, and we're missing on health, because like I mentioned, the lordosis in your cervical spine is primal. We call it the arc of life, because life is running through there. If it's not clear from there, it's not going to flow to the rest of the body. So the curvature in the neck is very, very important to keep and to stay up. Yes.
Christian, one last thing I want to ask you before you go, any advice you might have for maybe someone who's around your age, a teenager who thinks, well, I don't have back problems. I don't need to get my back checked or my spine aligned. What would you say to them?
You don't have to feel any issues with your body at the time, but they need to know that they should always go get checked, and for their body to always be good at all times.
Absolutely. Thank you so much for being here, Christian. We appreciate your feedback and more about this, but I do want to take a moment to remind our viewers. You can call in if you have a question. The toll-free number is 855-796-4475. Again, that number is 855-796-4475. We're standing by, and we love to hear from you. Soon he'll be joining your practice too, Dr.
Yes, I know. So exciting.
Now, because of the spine's anatomy, areas in the back affect communication and sensations between our nerves and our brain. And this allows chiropractic treatments to heal the body and the mind. So, Dr. Tovar, talk to us more about the mind and body connection when it comes to your work.
Well, one of the there's 5 factors of health, and I think it's so important to mention that, right? Because I go over that with my patients. It's important we are what we eat, so it's important to keep a clean diet, because that's how our cells are going to be made of. It's important to move and exercise, right? We need to get exercising, and when we exercise, osteophytes get excited, which are the cells that create more bone. Everybody's worried about their healthy bones, so please start moving.
Yes.
And the third, which is positive mental attitude. I say to my patients, if you believe that I cannot help you, then I won't be able to help you. So the mind is totally connected to your body.
Absolutely, got to manifest that positivity.
We are our thoughts, and what we believe, we will achieve and create our reality. So we have to start believing that indeed we have the power to heal, and the body will give us that much more. So the connection is amazing. And yes, it is important to rest and drink lots of water. Our body is 75% water. And the most important of the 5 is is to keep a healthy nervous system. So all the other things that you're doing for your health can be taken to the most in your body and be used correctly. But yes, the mind-body connection is extremely important.
Extremely.
It's all connected. We are, and that's why I developed a program, because I realized a lot of my patients were not getting the results they wanted.
And I want to get into that program, but it seems like a lot of your work as a chiropractor carries over to your job as a life coach and as a public speaker as well. So how does that work? Talk about this program.
I realized that a lot of my patients were not getting good because they had so many emotional baggage, and that was keeping them from their physical healing. That was keeping them from having the best physical healing they could. So I developed a program called Get Naked, and I know it's kind of a catchy phrase.
That's a catchy one.
It is
We're
a
paying
catchy
attention
phrase,
now.
But it's like the decluttering of your emotional closet, and now the tidying up that is very, very, famous.
We're gonna KonMari your emotions
Mary
now.
Kondo, and I don't know we can't mention her here, but good for you. That's just what it is. We just need to accept where we are, love who we are, because we don't need to. I'm not here to change anybody or to tell you what you're doing is wrong. I'm here to give you the awareness. So acceptance and then reflection of how we got there and seeing the benefits in every part of our journey. And then the Get Naked part is the release of all those emotions, all those feelings that no longer serve us. And then the part of the thriving is to create the systems that are going to help you reach your purpose, your mission, your life's goals, your whatever basic goal you have right now. Whatever it is, you have to go through that process in order to actually make a change that is going to be permanent. Right. Because if we do not do the emotional cleanup, it will keep coming back. We cannot patch it, just like we cannot patch the spine.
I like that, the emotional decluttering, because that is a huge part of that mind-body connection.
Yes.
So get naked.
Yes, get naked. Yes. I'm having a one-day Get Naked experience. So if you want that, please reach out to me. I'll give you all the details. And in those 8 hours, it's one-on-one coaching, but we will really, really do some heavy work to declutter that emotional baggage we keep carrying. It's like resentments. It's like baggage. It's like free rent on your mind. You know, you wouldn't want to have tenants not paying you, right?
No.
So that's what's happening when we keep all those resentments and that emotional baggage, that all those beliefs from the past that tend to dim our light.
And we're going to get, and I want to get more into that, but up next, we're going to get a closer look at wellness tips from the doctor herself and another testimonial. So stay with us. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question, please call in now using the toll-free number 855-796-4475. And remember, you can take the Health Channel wherever you go by visiting our website, allhealthtv.com. And you can watch a Health Channel live stream and check out videos from previous episodes. We'll be right back.
This is my kind of happy hour.
This is my kind of fast lane.
This is my kind of personal trainer.
My kind of joyride. My kind of nightlife.
Whether you're just finding your stride or making the golden years look good, Florida Blue goes beyond health insurance, investing in the health and communities of all Floridians. So you can feel good saying, that's my kind of blue.
This is my kind of blue.
This is my kind of blue.
This is my kind of blue.
Ovarian cancer is devastating and difficult to diagnose. It's often only caught in advanced stages, and 4 out of 5 women will see the deadly disease return.
I knew when ovarian cancer recurs,
it's often incurable.
It was terrifying, waiting for the other shoe to drop.
Until recently, following chemotherapy, women with recurrent ovarian cancer had to simply watch and wait for their disease to come back.
Well, we say,
not on my watch.
Not on my watch.
Not on my watch. Now, with maintenance therapies, women can extend their time in response and delay recurrence.
Knowledge and awareness of your choices empowers you
and gives you a greater sense of control.
Let's call for a change in ovarian cancer care.
The Not on My Watch movement empowers women facing recurrent ovarian cancer to take an informed and active role in managing their disease. Visit notonmywatch.com to learn more.
Strength training is important for all of us, but when we're talking particularly about women, it becomes crucial, especially after menopause. If you think about how we use our muscles, we use our muscles for everything. We use them during our daily lives, to go to the grocery store, to carry our kids, to play with them, to do stuff around the house. The more we prepare our muscles for these activities and the more conditioned our muscles are, the better off we will be, and sometimes even prevent injuries from those daily activities. Also, after menopause, when we lose the protective effect of estrogen as the levels go down after menopause, then it becomes more important, because strength training and resistance training can help maintain a healthier bone mineral density and sometimes even be a part of the treatment for osteopenia and osteoporosis. So I think resistance training for women is really important, it's critical.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio. With me is Dr. Aura Tovar, a chiropractor at the Dynamic Chiropractic Center, and she's also a life coach and a public speaker. We also have Adriana Lopez, a patient of Dr. Tovar. I want to remind our viewers to call if you have any questions for the doctor. That number is 855-796-4475. So first off, thank you, Adriana, for joining us. And we were just mentioning right before we came back that you've been getting adjusted since you were pregnant, and you have 3 children.
Yes, since my first pregnancy.
So tell me a little bit about your story and what brought you to Dr. Tovar.
I have a little bit of a background in chiropractic because my sister's also a chiropractor, my brother's also a chiropractor, but they live in Puerto Rico. So I was looking for a chiropractor here in Miami. And I actually walked in the office. I was pregnant with my first child. Okay. He's 12 right now.
Oh my goodness. So so for 12 years you've been doing this?
So for 12 years I've been going to her office. Not only myself, but my 3 kids since they were born. Well, since they were in the belly, basically.
So you take your 3 kids as well. They get monthly or how does it work?
We go weekly. I try to go weekly, but sometimes it doesn't happen. So I go every 2 weeks.
Mm-hmm. So tell me a little bit about that decision to go for these chiropractic care, and that you still continue with your kids. Why was it important to you to do that?
Well, first with my pregnancy, because I heard that it was good for the whole pregnancy, like how you feel better, your those pains that sometimes you get. Those pains, yes. so that definitely helped me a lot. I heard that it would help me with the position of the baby when it was time for the baby to turn around itself. So I started for that reason.
And did you feel there was a difference in your pregnancy?
It helped me a lot. Yes, It did help me a lot. It helped me sleeping better in my pregnancy. It helped me.
Oh, that's key.
It was amazing. And then obviously, then when I got pregnant with my second one, actually with my first baby. As soon as he was born, I took him the first week.
Really?
And then I continued myself to get adjusted because I needed to get back again. It's really important, my body was getting used to the
being aligned.
Yes, and everything. So I continued to go, and then I got pregnant with my second one, and the same story with all my 3 children.
Now, you said your oldest is 12. If you can share the ages with 12.
12, 10, and 5.
So with the 3 kids, do they talk to you about going to the visit or how they feel?
It's for them. It's like drinking water. Like it helped. A lot of things that I've seen. You know how it gets to a stage when they start getting nightmares. Also, immediately, like I know, okay, you need to get adjusted, or like sleeping better when they were very babies.
Yes.
It's amazing. Like with the colics. With the whole, even with their babies, sometimes you don't even think because they can't talk to you, they can't really tell you. But I see it as a mom that it will help.
Right.
Now they're older. My 2 older boys, they play soccer, they play basketball, and it really helps them to stay, with the energy and healthy.
And Dr. Tovar, when you work with kids, and in the case of Adriana as well, that mind-body connection, that begins very young, correct?
Yes, yes, yes. And then their immune system gets stronger, which it just helps them thrive in all areas of life. If you compare a kid that has been, taking antibiotics constantly to a kid that gets adjusted all the time, it's such a difference in the energy, in their posture, in their, in how they do in school. It's a difference of something that we cannot even measure.
Right.
So it's hard to speak about, but you see their attitudes, you see how they respond.
Right.
So yes, the mind-body connection is more clear. It's just like I have it in my office. It's the power that made the body heals the body, but it has to run through your brain, into your spinal cord, out the nerves to all your areas of the body.
Adriana, one last question for you. Do you notice a difference, let's say if you'd like to go weekly, do you notice a difference, let's say if you can't get to the chiropractor's office weekly? Do you notice that maybe things are off? And you really need to go.
I used to get a lot of migraines. So chiropractic care helped me a lot with my migraines. I don't take medications anymore for that. So yes, it does help me. Like I live a healthy lifestyle. I do exercise every day. I eat healthy. For me, chiropractic care is kind of like part of eating right, eating healthy, doing exercise, and I have to get adjusted.
Absolutely.
Like if I don't get adjusted 1 week, I'm like, I tell her sometimes, I need it. I need to go get an adjustment.
You were addicted to getting adjusted.
It's part of me. I see it as a lifestyle.
Right. And so now what advice do you have for someone who might be watching and maybe contemplating, like saying, maybe this is something that would help, not just physically, but mentally and emotionally as well?
Go see her, go get checked, go get your scan, and see what's going on. Like she said earlier, you never know where those obstructions are happening, so it's very important to go get checked.
Thank you so much, Adriana, for sharing your story. Now, we just have a few minutes left, so I do want to remind our viewers, you can call in if you have a question. That number is 855-796-4475. Again, that number is 855-796-4475. We'd love to hear from you. Now, how can someone find a good doctor for chiropractic treatments? And also, another big question, is it covered by insurance?
I always tell my patients when they ask that, yes, we take a lot of insurances, but I always ask them back and said, is your gym membership covered by insurance? Is your organic food at Whole Foods covered by insurance? It's not, because the healthy choices that we make is not covered by the insurance. We're covered just when we're really sick, but it's not about keeping you healthy. Those has to come from you, and it's a choice that when paid now is way cheaper than when you have the disease later.
Absolutely.
So it is the best choice. But yes, to choose a good chiropractor, please make sure. I know plenty, so you can contact me. I could refer you out if you're not in my location. But it's find a chiropractor that is looking for subluxations, that is looking for the cause of the problem instead of all the other services, which are great to get. But first, we need to clear the cause, so then the effects can give you the health you want.
And I think it's important to know how you also help your patients with other lifestyle choices, because diet and exercise play a huge part. I mean, what's the point of coming to get adjusted or your therapies if you're not extending that to other areas of your life?
Yes, that's why I speak about the 5 factors of health that I mentioned previously. Yes, it is important to eat and to clean our toxins from our lives, because we are surrounded with too many toxins. So we have to start cleaning mind, body, and soul, right? So whereas we clean the core and we remove the obstructions with the nervous system, then the body is more receptive to the other changes, whether there is a stretching program, an exercise program, a program to clear your mind of your mind baggage like it naked is. All those things are things that I work with my patients because I want them to get the life they want, and I want them to reach all their health goals, not just the ones that they came in for, complaining of in my office.
I think it's important to know you do also a lot of great work abroad, and you share this chiropractic care on a mission called the Chiro Mission.
Yes.
So can you talk to me a little bit about the Chiro Mission and what it is and why it's important to get out there and not just do work here, but also maybe in less fortunate areas?
Yes. I am the vice president of Chiro Mission. It's a nonprofit organization, and I've been with them for 10 years. And we have taken many trips, and I've led I don't even know how many mission trips, about hundreds and hundreds of individuals, whether they are chiropractors or chiropractic students or volunteers just like you, Kathy, that come to give out of their heart. Because when you give, you get that much more in return. I always say giving and serving is selfish, because when you give and open your heart and mind to others that are not as fortunate as you are, you always get that much more back. So giving is amazing. So please join a mission of any sort. If you feel stuck in any area of your life, join a mission. Do a mission and give of your heart and see how the rest of us, how the rest of the world lives, and give a little bit of your love. Whether you have a special skill that you can give, like we do as chiropractors, and we do that for them for free, and we go to churches and jails and hospitals. We go everywhere to give of our services to help them live better, to give them a little bit of hope
and a little bit of life.
Yes, a little bit of love. And we have built an orphanage as well, which we raised 48 children. So we have had a lot of help from chiropractors all over the world, and yeah, it's a mission of love. And when you give love, you get that much more. So yes, it's beautiful.
That is beautiful. Healthy body, healthy mind,
healthy spirit.
Absolutely.
Indeed,
it was so great having you, Dr. Tovar, on the show, and thank you so much for having guests as well. That does it for us this hour. Be sure to join us next time on the Health Channel. All Health All the Time on South Florida PBS, and follow us on Facebook, Instagram, and Twitter using the hashtag AllHealthTV. And please be sure to visit our website, allhealthtv.com, where you can watch a Health Channel live stream and watch videos from previous episodes like this one. I'm Kathy Buccio. I'll see you next time.